Today we're going to be discussing the infectious disease tetanus that is 100% preventable and can be fatal. Tetanus is an infection caused by the bacteria Colostrum tetani. When the bacteria enter the body and release a toxin that affects the nervous system, resulting in a painful muscle contraction, tetanus is also referred to as lockjaw because it often causes the patient's neck and jaw muscles to tighten, making it hard to uh, open the mouth or to swallow. Um, the history of tetanus has clinical records that go clear back to the 5th century BC. But it wasn't until 1884 that the disease was first produced in animals by injecting them with pus from fatal human tetanus case. In that same year, it was also produced in animals by injecting soil samples in them. As time goes on, a method for inactivating the tetanus toxin with formaldehyde was developed in the early 1920s. This led to the development of tetanus toxoid in 1924, which was first widely used during World War II. And by 1948, the tetanus vaccine became available in a combined vaccine, DTP, with diphtheria toxoid and the pertussis vaccine. The mode of transportation is through injury, a break in the skin, or a scratch. Well, a break in the skin. These wounds could be contaminated with dirt or feces or saliva. They could be puncture wounds from a nail or a needle breaking the skin, from burns, from crushed injuries where pressure from another object or you're being squeezed between two objects also break the skin, or injuries concerning dead tissue, with a lack of blood flow or a serious bacterial infection. Symptoms of tetanus is intact sensorium, where the patient is cloudy, has a hard time concentrating, is just not with it. Headache, difficult swallowing, sore throat, irritability, toxic spasms, facial spasms where there's a fixed smile or elevated elbows, jaw stiffness, fever, restlessness, chills, exaggerated reflexes, and profuse sweating. There are also complications from these symptoms. Your voice box can spasm. You can cause bone fractures from the convulsions, hypertension, nosocomial infections, pulmonary embolism, aspiration pneumonia, and death. If you are getting these symptoms of tetanus, it is a medical emergency and needs to be taken care of with hospital care. The immediate treatment with medicine called human tetanus immune globulin, TIG, aggressive wound care, drugs to control the muscle spasms, antibiotics, and depending on how serious the infection is, you could be put on artificial breathing. There is a tetanus vaccine, which makes this a preventable disease. It's for different. There is a vaccine for all different ages. So young children, 2, 4, 6 months old, 15 months through 18 months, or 4 to 6 years, they would receive a DTaP vaccine. Or for preteens, 11 through 12, a Tdap. Or adults, every 10 years, would receive a DT or a Tdap. With the vaccines being so readily available, we don't really see this in North America. The areas that we do see tetanus in today's world are South America, Africa, and Asia. Among infants who get tetanus, 80 to 100% will die. In 2019, the Global Burden of Disease study estimated over 73,000 total tetanus cases, including over 27,000 neonatal tetanus infections. And an estimated 34,700 tetanus deaths occurred worldwide in the South America, Africa, Asia. So this is where we are lacking in vaccinations. If there are any questions, thank you.